Assalamu alaikum and peace be with you. Welcome to this series on understanding and addressing vaccine hesitancy in the Muslim community and coming from an Islamic perspective. Inshallah, in today's episode, we will be looking at some of the claims made by individuals or groups who have reasons for being hesitant or apprehensive or even anti-vaccination. We'll be looking at questions such as those made by some. Why should I take this vaccine if me and nobody in my family has any problem? Like, we don't need it. Why should we risk the side effects? It's not our problem. And while we've addressed this a little, we would like to take another angle to it this time around. Also, questions to do with the quality of the vaccine, especially where storage may be a challenge according to some. The lack of electricity in some parts of the country, how can we trust that the vaccine has maintained its quality all the way to the person who is to be vaccinated? The other concern that some have raised is that these vaccines are not safe for pregnant mothers or lactating mothers, and that it should not be taken by them because it may affect pregnancies. I am your host, Muhammad Nuruddin Lemu, and with me to discuss today's topics are two of our distinguished guests, Brother Ibrahim Bello, who has a master's degree in biochemistry and works with the IBB Specialist Hospital, and somebody also from another science background, Sister Bilkis Garba Ibrahim. You are both most welcome. Assalamu alaikum.
Alaikum assalam wa rahmatullah.
I'd like to start with you, Brother Ibrahim. How would you respond to those who view the problem that this vaccine is trying to solve is not their problem, and so they don't need to get involved? I'm fine, my family is fine, leave me alone. Go to people who would be having these type of challenges, let them be vaccinated. What would you say?
Yeah, it is true that part of the claim people make to avoid taking vaccine is that I am not sick, so why do I need it? But the truth is that vaccines are not meant to cure disease, but they are meant to prevent.
Mm-hmm.
Okay? So basically, they are given ahead such that they will prevent viral or bacterial infection. Or at least, even if it eventually affects the person, then the severity will be less. That's why they are called vaccines, so to say. So you don't wait to say till when you are infected. And by the way, how do you know you are not infected?
That's the other thing. Sometimes
you might be infected, but because your immune system is stronger. But then you will be a carrier. And there are higher chances you transmit it to other people whose immune system are weaker than you. It might even lead them to death. People have made these mistakes a lot, and this is the kind of things we are seeing with hepatitis B now in the society. Because people don't go for medical checkup, this disease is spreading like wildfire, as contagious as it is. Why? Because those who have it, possibly their immune system is stronger enough, but they continue to spread it to other people, it leads to their death. So another important thing again is, vaccines are meant to prevent, viral and bacterial infections. But aside that, when people take vaccine, it's meant to give the community a sort of what you call herd immunity. In a situation where you have more than 70% of the members of that community being immunized. So this confer immunity on the remaining members of the community. So if people start giving this kind of good excuses one after the other, a great number, just like it was said in one discussion that only 1/3 were immunized against COVID-19. That's deadly, that is threatening, that is scary in immunology. More so, vaccine or vaccination is the cheapest and the safest primary preventive measure in public health. In that, it saves a lot. It saves a lot of people from falling sick. This is from practical, real data. It has saved communities, it has prevented a lot, and it has helped in the past in eradicating various diseases. And by the way, if you are really a true Muslim or a good member of the community, Allah subhanahu wa ta'ala told us that وَالْمُؤْمِنُونَ وَالْمُؤْمِنَاتِ بَعْضُهُمْ أَوْلِيَاءُ بَعْضٍ. that believing men and women are supporters, allies, and protectors of one another. How better can you be a protector of your brother than to take vaccine that will prevent him from getting contracted with the disease? So like people should rethink again and not look for any good excuse. Vaccines are meant to
Which
prevent.
is usually a bad excuse.
A bad excuse, of course. And you know, vaccines are actually, they've solved problem in the past. And most of people who come with these claims, they're just mere claims. They're not based on any data. They are not spoken by professionals. Like you look at, just like our verification method in the past, who is speaking? Where do you get your information? How do you know? Like all these things are missing. But the concern is how people listen hook, line, and sinker to anybody that just says anything and get along the way. So this is it.
Jazakallahu khairan, Sister Bilqis. What will you add?
Yes, while Mala Ibrahim was speaking regarding vaccine not being a cure but rather a preventive measure, it reminds me of the metaphor of an umbrella on a rainy day. You know, when it is raining, we use an umbrella. It is not we do not use the umbrella because the umbrella has the power to stop the rain from falling, but rather because it protects us from getting soaked up. So that is more like the same way that vaccine works. Vaccine prevents the virus from infecting us, not that it will cure us from the virus. And also the claim that just because you think you do not have the virus, so you do not need to get vaccinated. We have different hadiths of the Prophet ﷺ that talks about the reason why we should care for each other. So just because you do not have the virus, you could possibly have the virus, just like Brother Ibrahim has said. Probably you have the virus, but your immune system is strong enough for you to notice it. Then it won't stop there. You could possibly pass it to another person. Probably the immune system of that other person you are passing the virus to is not as strong enough to prevent the virus from being severe in his own body. And probably the person might even have an underlying sickness which could cause the death or something or a form of severity of the illness. We have the hadith of the Prophet ﷺ which says, "La yu'minu ahadukum hatta yuhibbu li akhihi ma yuhibbu li nafsihi." None of you is a true believer until you love for your brother what you love for yourself. So that means if you want a form of cure, a form of yourself to be immune to the virus just the way others will be immune to it, get vaccinated to prevent you from spreading it to others. We also have beautiful metaphoric ways that the Prophet ﷺ described the kind of relationship we are supposed to have with each other in Islam. One of the beautiful metaphors the Prophet described a Muslim and another Muslim is Al-mu'minu lil-mu'mini kal-bunyan tashuddu ba'duhu ba'. That is, a Muslim to another Muslim are like a building. One part of the building is strengthening the other part. So that is the kind of relationship, that is the kind of strength we should give to each other as Muslims. Not that we should just think, okay, since I do not have it, I do not care whether the other person have it, so I do not need to take it. Another beautiful hadith, the love and compassion and mercy between Muslims are like a body. When part of the body is sick, when a limb in the body is in pain, the other remaining part of the body reacts with restlessness and lack of sleep. So that is how we should act. That is the kind of mindset we should have with other Muslims in our relationship. So we get vaccinated not because we might not get severity of infection of that illness, but rather because we care about each other enough to prevent the illness from spreading. Allah.
Jazakumullahu khairan. And it reminds me of the hadith where the Prophet ﷺ said, the believer who lives with others and bears their inconveniences is better than the one who avoids people and doesn't have to deal with the inconveniences of people. The Prophet ﷺ lived in a place like Mecca and bore the type of challenges. And from there we find as Muslims this issue of me going through some difficulties just because of you. But that's part of Islam, that you love safety for others, not just for yourself. And if it means I will go through the inconvenience of getting a vaccine, even though my immune system, from all I see, I'm not suffering, it's not a problem for me, Why should I go through that inconvenience? Because you are supposed to, as you say, respond to pain the way the body responds. We empathize, we show compassion, we try to solve problems, or as you said, like a building that reinforces each other. Somebody else taking the vaccine, by the time you get old or you get an underlying condition, that's when you actually start saying, Alhamdulillah, somebody else took the vaccine that prevented me from getting it. So, but why should others go through inconvenience and you are not ready to go through? I remember scholars quoting a saying that has not been attributed to the Prophet. Some have attributed it, but where they would say, whoever doesn't care for the affairs of the Ummah is not a member, or is not behaving like a member of the Ummah. The Ummah is of people who, as you put it, are awliya of each other, are protecting friends and supporters of each other. The second issue that I'd like us to look at, Sister Bilqis, this question of storage of vaccination. It's understood that these vaccines need to be kept in some form of cold storage to preserve their quality and their potency and effectiveness. But looking at the electricity problems we have in Nigeria and in some countries, and especially if you're going to have to take these things to remote places that don't have electricity, some are questioning, isn't that enough time for these vaccines to decompose, to spoil, to no more be effective? And so some are actually presenting it as if it's a fact that the distances these vaccines have to take to come all this way with no electricity in cars, etc., there's no way these vaccines could still be good. And that these are damaged vaccines that are being distributed. It's just a waste of time. What would you say to that?
Well, vaccines, just like our normal food and drugs, they come with their own expiry date. Just the way we have in packed food, because vaccines do not come as fresh vegetables or fresh fruits. They come in a package, so they are packaged. They come with a production date and also an expiry date. So just the way our food or our fresh vegetables, after a while, it begins to show signs of rotting or decomposing, we do not consume, but rather we try to get rid of them. So also vaccines. Once vaccines reaches that expiry date, there is no how a person is going to use that vaccine. Rather, they dispose it. In fact, there was a recent scenario that happened in Abuja regarding some drugs being destroyed. It was a certain vaccine known as AstraZeneca vaccine, which passed its expiry date. It's reached its expiry date, and there was so much of it. In fact, over 1 million of that vaccine. So it had to be destroyed in an open field in Abuja. The National Agency for Drug Administration and Control, in collaboration with other agencies like the Abuja Environmental Agencies, had to destroy those vaccines. They destroyed it not because of anything, not because of anything, but because it might pose a risk to the public if they leave it as that. Also, we should try to be careful. We should try to be careful in the sense that we do not point fingers to people and individuals, to organizations, just because of mere claims. We have a legal maxim of Islamic jurisprudence which states, La ibratu li tawahhum, that is, there is no judgment that is based on guesses or mere claims. You do not pass judgment based on mere claims, based on what if, based on probably, based on doubts. No, we pass judgment based on certainty, based on, yes, we are sure there is complete evidence. Just like our the maxims that we've mentioned before, that is, certainty cannot be overruled by doubt. So we need to be very careful. We are already certain, we've already seen enough proof regarding this vaccine. So just because someone is coming and telling us, okay, what if, we shouldn't go with the what if, but rather, let's ask that person, why don't you provide an evidence to us that yes, this claim is actually authentic?
Jazakallahu khairan. Allah Ibrahim, what would you add?
Just like he said, it's true. Usually these vaccines are transported from one place to another in cold chains, where you have these ice packs. That will give them, will keep them at that temperature for 24 or 48 hours. And they, as long as they sense these things are draining, they change them. Like for those who want to be honest, people who have been involved in these vaccines knows that all these are just mere claims. They don't have evidence. And like we say, al-bayyinatu ala al-mudda'i. For anybody that will still insist as this as a claim, let him prove it. Similarly, we should be careful. Once we're sure that these things are taken care of, and we're sure that to a great extent these things are preserved, there is evidence for their safety and their importance, then al-yaqin la yazul bi shak, like she says. Also, it is not okay for somebody to just for his own personal interest to be pointing accusing fingers at others. As Muslims, Allah warned us on that. He said, وَلَا تَلْمِزُوا أَنفُسَكُمْ وَلَا تَنَابَزُوا بِالْأَلْقَابِ. Stop pointing accusing fingers, slandering, trying to castigate or create unnecessary loopholes or blackmail others. Like the whole of Surah Al-Hujurat has taught us as Muslims. So let us be very cautious of what we say. And these things are very important, particularly if the person making this claim in question has audience, is a scholar, is an authority, is a gatekeeper. Because people are ready to die on your claim by just mere instructions. So Allahu Alam, this is as much as we should.
And one will not be surprised that some people have died. Some people have suffered from these diseases that vaccination could have prevented if they didn't use their mimbar or pulpits to speak about what they have no knowledge about. And I think, for everyone to always keep asking yourself, where do you get your information from?
Yeah.
How do you know it is true?
Yeah.
What is the credibility of the source you are now listening to that is so authoritative as to push aside Islamic Medical Association's Centers for Disease Control, World Health Organization, and what's the consequence and who takes responsibility for that?
Nobody.
Yeah, unfortunately, but Allah is counting. وَمَن يَعْمَلْ مِثْقَالَ ذَرَّةٍ خَيْرًا يَرَى, but also شَرًّا يَرَى.
Sure.
May Allah continue to guide and protect. The next question, which I wanted us to look into, Malam Ibrahim, is the claim by some that vaccines are not safe for mothers who are pregnant or women who are expecting, but also that it is not safe for lactating mothers, those who have given birth, are breastfeeding their children, that these people should not take the vaccines. What's your response to that?
Well, to start with, we should just be cautious. By now we should have gotten some thinking tools. Who says what? What is his credibility? Who is he? Is an authority on that? And what is his evidence? Are they scientific? Are they proven? Nevertheless, it is not true, simple. There is no evidence that vaccines, particularly COVID vaccine, is not safe for pregnant mothers. Why? Many pregnant women took it and they are fine. And for those making the claim, what is their evidence? Kul hatu burhanakum in kuntum sadiqin wa Muslims. Okay, prove it. Provide your evidence. In fact, doctors will even encourage that the COVID vaccine should be taken, and even the booster dose should be taken by pregnant women. Why? Because it will give her more protection. She needs it at that time.
Exactly.
So we should be careful of making mere claims, because we don't have any record of where pregnant women took it and it affected them in any way. Of course, there are exceptional cases like measles and smallpox vaccines, and just like with any other drug, where some category of people will be exempted, but it is not related to all vaccines. And where those are involved, doctors make clarification, and in fact, they will ask before giving. But that has nothing to do with generally taking vaccines, particularly COVID vaccines. Yeah.
And I think MPV also belongs to that category of not being harmful. Sister Bilkis, what would you add?
Well, just as Mala Ibrahim has mentioned, there is no evidence that these vaccines poses any form of risk to the pregnant woman. Also, to those people making all these claims, there is a legal maxim in Islamic jurisprudence which states that al-bayyinatu ala al-mudda'i, that is, evidence should be brought by the person making the claim. So the people making all these claims, you should know that they are the one that will provide the evidence, not the already credible individuals. And also, we've already learned before that before taking any form of drug at all, before taking any form of vaccine, if you are pregnant, if you are lactating, or if you have any form of underlying sickness, you should consult with your healthcare provider.
Jazakillahu khairan. And, I think sometimes it's as if we're going on roundabouts when it comes to these topics of vaccine. And it seems to keep boiling down to who are you listening to?
Exactly.
As you've said, this al-bayyina al-mudda'i, that the requirement for evidence is for the person accusing. Wal-yamin ala man ankara. All that the person who is accused needs to do is to swear. In other words, in simple English, the people are innocent until proven guilty. That the World Health Organization, the National Centers for Disease Control, the medical professionals who are experts in this area, they have had a track record of solving problems. They are the experts. They are the Ahl Zikr that we have been asked by Allah to consult when we are not in the know. The scale of certainty is definitely, we are more certain about their information. Even the individual who is bringing all these claims, who do you go to when your child is sick? You know you are not the one who is going to treat them. You know on healthcare that there are people who are experts, but to keep throwing issues that create doubt, storage issues, lactating mothers, etc. And I think we've discussed already in some earlier episodes, some people just have different reactions and side effects for the vaccine, like we have with any other medication.
Which is normal.
Which is normal. Some people are allergic to milk. Some people are allergic to caffeine. Some people are allergic to groundnuts. Some people are allergic to everything. It's difficult to find something. And all you need to do is just go online and type out in Google the dangers of consuming, put anything there. Somebody will tell you, probably with the exception of things like water. But but don't be surprised. People are also hydrophobic. People have a psychological fear of water. And I think for some people, there's a vaccine phobia. A phobia is an irrational fear. Fear is a natural response. We should be concerned about dangerous things that have side effects, etc. But when you've consulted with the experts and they say, no worry, take the medicine. Yes, it has side effects, but the benefit is greater than the harm. To be really careful about making it our mission to allow our own phobia, our own fear of an injection, our own fear of the side effect, to now start to create rumors that make other people start hesitating about, listening to those authorities. May Allah continue to guide us and help us all. We'll stop there, inshallah, with this episode. Jazakumullahu khairan. Thank you for your contributions and insights. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh.
Bismillahir Rahmanir Rahim.